Welcome everyone to today's lecture on Parkinson's disease. In this lecture, we will be discussing the neuroanatomy of the basal ganglia, the pathophysiology of PD, clinical presentation and diagnosis, pharmacotherapy options, surgical treatment options, non-pharmacological interventions, the role of genetics, animal models of PD, neuroprotective strategies, gastrointestinal dysfunction, cognitive dysfunction in PD, emerging therapies, and finally, a conclusion summarizing our key takeaways. The basal ganglia, an essential part of the brain, consists of several interconnected structures: the caudate nucleus, putamen, globus pallidus, subthalamic nucleus, and substantia nigra. These structures play a pivotal role in regulating movement, cognition, and emotions. In Parkinson's disease, the malfunctioning of these structures leads to the characteristic motor symptoms of the disease. Understanding the detailed anatomy and intricate connections within the basal ganglia is fundamental for comprehending the underlying mechanisms of Parkinson's disease. Parkinson's disease is characterized by the progressive loss of dopamine-producing cells in the substantia nigra, leading to a decrease in dopamine levels. This imbalance in neurotransmitters disrupts the delicate circuitry within the basal ganglia, resulting in motor symptoms such as tremors, rigidity, bradykinesia, and postural instability. The underlying mechanisms contributing to the neurodegenerative process are multifactorial and may involve genetic predisposition, environmental factors, and oxidative stress. Diagnosing Parkinson's disease can be challenging as it primarily relies on clinical evaluation. Common symptoms observed include resting tremors, muscle rigidity, bradykinesia, and postural instability. Additional non-motor symptoms such as depression, sleep disturbances, and autonomic dysfunction may also be present. Various diagnostic criteria, including the UK Brain Bank criteria and the Movement Disorder Society criteria, aid in establishing a definitive diagnosis. Pharmacotherapy plays a pivotal role in managing the symptoms of Parkinson's disease. Dopamine replacement therapies, such as levodopa, are the mainstay of treatment. Other medications, including dopamine agonists, MAO-B inhibitors, and COMT inhibitors, are used in combination or as monotherapy, depending on the patient's individual needs. Understanding the pharmacokinetics and potential side effects of these medications is crucial for optimizing patient outcomes. For patients who do not respond adequately to pharmacotherapy or develop medication-related complications, surgical interventions can be considered. Deep brain stimulation, DBS, is a widely used surgical technique that involves electrode placement in specific regions of the basal ganglia to modulate abnormal neuronal activity. DBS can provide substantial improvements in motor symptoms and quality of life for suitable candidates. In addition to pharmacotherapy and surgical options, non-pharmacological interventions play a vital role in managing Parkinson's disease. Physical therapy, occupational therapy, and speech therapy help improve mobility, dexterity, and communication skills. Exercise programs, such as aerobic workouts and dancing, promote neuroplasticity and overall well-being. Assistive devices and adaptive strategies aid in daily activities and maintaining independence. Parkinson's disease is believed to have a genetic component, meaning that certain genes can increase a person's likelihood of developing the condition. Researchers have identified specific genes, such as Parkin, LRRK2, and PINK1, which are associated with familial forms of Parkinson's disease. By studying these genes, scientists hope to gain a better understanding of how the disease develops and potentially identify new treatment approaches. These genetic studies hold promise for uncovering the underlying mechanisms of Parkinson's disease and finding new targets for therapy. Animal models play a vital role in advancing our understanding of Parkinson's disease, PD. These models, including rodents and non-human primates, enable researchers to explore the underlying mechanisms of the disease, examine the effectiveness of new treatments, and assess potential neuroprotective approaches. By using animal models, scientists can gain valuable insights into the development and progression of PD, leading to discoveries that can be applied in real-world clinical settings. Animal models serve as a crucial bridge between laboratory experiments and the medical field, facilitating the translation of research findings into practical applications for patients with PD. Parkinson's disease is a neurodegenerative disorder characterized by the loss of dopaminergic neurons in the substantia nigra region of the brain. While current treatments focus on managing the symptoms, such as tremors and muscle stiffness, there is a growing need for strategies that can protect and preserve these neurons. One potential approach is through the use of antioxidants, which can help reduce oxidative stress and prevent further damage to neurons. By neutralizing harmful free radicals, antioxidants may slow down the progression of Parkinson's disease. Another avenue of investigation is the use of anti-inflammatory agents. Inflammation in the brain plays a role in the progression of neurodegenerative diseases, including Parkinson's. By targeting and reducing this inflammation, it may be possible to slow down or halt the neurodegenerative process. Furthermore, neurotrophic factors, which are proteins that support the growth and survival of neurons, show promise as neuroprotective agents. These factors can promote the survival of dopaminergic neurons and potentially slow down the progression of Parkinson's disease. However, developing effective neuroprotective strategies is not without its challenges. One major obstacle is the difficulty of delivering these agents to the brain. The blood-brain barrier, a protective barrier surrounding the brain, restricts the entry of certain substances, making drug delivery to the brain a complex task. In conclusion, the search for neuroprotective strategies in Parkinson's disease is an active area of research. Promising approaches include the use of antioxidants, anti-inflammatory agents, and neurotrophic factors. Understanding the potential targets and challenges in neuroprotection is crucial for the development of disease-modifying therapies. Gastrointestinal dysfunction is a common non-motor symptom associated with Parkinson's disease. This includes constipation, dysphagia, gastroparesis, and alteration in gut microbiota. The bidirectional communication between the gut and the brain, known as the gut-brain axis, plays a significant role in PD pathology. Understanding the impact of gastrointestinal dysfunction and exploring potential therapeutic interventions is essential for comprehensive disease management. Parkinson's disease is not limited to motor symptoms. Cognitive impairment is also prevalent in a significant proportion of patients. Cognitive deficits typically involve executive functioning, attention, memory, and visuospatial skills. Studying the cognitive aspects of PD helps in identifying potential biomarkers, improving diagnostic accuracy, and developing specific cognitive interventions to enhance patient outcomes. In the field of Parkinson's disease research, scientists are currently exploring new treatment options to enhance disease management. These promising therapies encompass immunotherapy, which utilizes the body's immune system to target Parkinson's-related abnormalities. Stem cell therapy involves using specialized cells to replace damaged neurons and restore proper function. Gene therapy aims to introduce functional genes into the brain to correct underlying genetic defects. Additionally, neurostimulation techniques involve using electrical impulses to modulate brain activity and alleviate Parkinson's symptoms. The investigation of these emerging therapies offers optimism for improved disease control and ultimately finding a cure for Parkinson's disease. In conclusion, Parkinson's disease is a complex neurodegenerative disorder affecting multiple systems within the brain. Comprehensive understanding of the neuroanatomy, pathophysiology, clinical features, and treatment options is essential for effective management. Further advancements in research and the development of emerging therapies offer promising prospects for enhancing the quality of life for individuals living with Parkinson's disease.